Welcome to the ME8 Ultrasound System tutorial video. In this video, we will go over system functionality and step-by-step instructions on how to use the system tools and features. The power button is located on the left side of the system. To put the system in standby mode, either close the monitor or press the power button and select standby. If the system is in standby mode, there will be a moon icon flashing on the bottom left of the control panel. To wake from standby, either open the monitor or press the power button again. The system boots in 5 seconds from standby. To adjust the height of the system, depress the handle on the cart to raise or lower. To lock the wheels on the cart, press the lever at the top of the wheel. To unlock, lift the same lever on the wheel. The ME8 cart features a retractable power cable. Pull the power cord out to the side to lock the cord in place. To retract the power cord, pull it to the other side and the cord will retract on its own. There are 3 active transducer ports on the rear of the ME8 cart. To connect a transducer, flip the tab to the left to unlock. Secure the transducer and push the lever to the right to lock into place. It is recommended that the system be frozen or powered down to connect and disconnect transducers. On the left side of the system, there are ports for the following: S-Video, Ethernet, HDMI, and 4 USB ports. The basic workflow of the ME8 is illustrated by accessing the main menu with the white arrow icon along the left or by swiping the touch panel to the right. Press the Info tab to access the patient information screen and enter demographics if desired. Use the trackpad and set keys to move through the data fields. The system will assign a generic patient ID that includes a date stamp if no data is entered. If purchased, a barcode scanner can be used to scan a patient's wristband, or a DICOM work list can be queried. If applicable, both of these options will be set up by an application specialist upon installation of the system. To query a work list, simply select the Work List tab on the right of the patient data screen and click Query. A list of patients will appear to choose from, or manually input search parameters at the top of the page. Choose the desired patient or select OK once all information has been entered in the demographic page. Next, choose the Probe tab. This is where both probe and exam preset are selected. Tap on the picture icon of the desired preset to begin. Note that tapping on the picture of the probe itself will activate the default preset, which is demarcated by a check mark on the icon. Return to the Probe tab at any time during scanning to change presets or probes, or to reset imaging parameters if needed. Now the system is ready to scan. The ME8 features a streamlined keyboard and a customizable touch panel. The main controls for depth, gain, modes, zoom, and save images are found on the control panel keys. Imaging parameters and other functions are found on the touch panel. An application specialist will assist in customizing the touch panel tabs and programmable keys upon installation. The information banner along the top of the monitor includes the transducer and imaging parameters, the patient data, exam, and date and time. There are also a set of icons along the bottom right which provide information about wireless, task management, the recycling bin, hard drive capacity, and battery status. Use the cursor and trackpad to select these items. Along the bottom left of the screen, programmable key functions can be viewed. Return to basic workflow tabs by either tapping or swiping the white arrow icon. Any images or clips taken during the exam may be reviewed with the Review tab. To access any measurements taken, tap the Report tab to see or edit any measurements. Once the study is completed, press End. The iStation tab activates the patient archive or hard drive. Review, delete, or send past exams from this page. Prior exams may be reactivated for up to 24 hours in order to add or change data. To do this, highlight the desired exam, then tap Activate Exam in the drop-down menu. Other available options will be illuminated, including to manually send an exam to PACS or other storage media. This concludes the basics of the ME8 workflow. On the right side of the ME8 control panel is a depth toggle and overall gain control knob. Above the depth toggle is a zoom key. After pressing zoom, use the touchpad and set keys to the right and left of the touchpad to adjust the position and size of the zoom box. To activate the zoom feature, press the zoom key, and to exit zoom, press the B mode key. To the left of the zoom key is the dual key. When dual is activated, two screens will be displayed. To move between the two split screens, press the dual key again. To exit dual, press the B mode key, which also acts as a home key. On the left side of the control panel is the iTouch key. This is the auto gain optimization. Once it is pressed, the key will stay highlighted. To turn it off, press and hold the iTouch key. iTouch can be used in both B mode and pulse wave mode. The freeze key is located on the lower right side of the control panel. Use freeze in order to measure, annotate, or print an image. Also, when an image is frozen, there is the ability to cine back to review and save previous frames. To cine through the image, swipe left on the touchpad. Other cine functions can be found by tapping the Cine tab on the touch panel. To save an image, press freeze and the save key, or save an image on the fly by simply pressing save without freezing. To save a clip, a key can be configured in the setup menu to perform this function. Major modes are located around the touchpad for easy access. Imaging parameters for each mode will be found on the touch panel when each mode is activated. B mode is your grayscale imaging mode. To turn on color, tap on the C key on the right side of the touchpad. To change the size and position of the color box, use the trackpad and the set keys to the right and left of the trackpad. Now that color is activated, the gain wheel works to increase and decrease color gain. To exit color mode, either press the C key again or press the B key just below it. To enter power Doppler, press the P key on the right side of the keypad. To enter pulse wave Doppler, press the PW key. Position the PW sample gate in the desired position by using the trackpad. There are two ways to activate Doppler. Press the PW key again, or press the Update key, which is above the trackpad. To exit PW, press the PW key again, or the B key. To access M mode, press the M key on the left side of the keypad and position the sample line on your image by using the trackpad. To initiate, press the M key a second time or press the Update key. On the left side of the control panel, there is a cursor button that will activate an arrow on the screen. The arrow can be used to select thumbnails on the right side of the screen or display functions in the toolbar at the bottom of the screen. The P1 through P4 keys are customizable and will be programmed by your application specialist. Measurements on the ME8 are divided into two types, caliper and measure. The caliper key on the right side of the trackpad will take generic calculations like distance, area, and volume. When pressing the measure button, which is located on the left side of the trackpad, there will be labeled measurements specific to the exam type. For example, crown rump length in OB or ejection fraction in cardiac. These measurements will go into a report. Take a basic distance measurement by freezing the image and pressing the caliper key. Move a finger on the trackpad and drag the caliper to the desired start position of the measurement. Tap the trackpad after placing the first caliper to enable the second caliper. For multiple calipers on the image, tap the trackpad and slide a finger to bring up an additional caliper. The Update key above the trackpad will toggle between calipers to reposition if needed. Note that the caliper is green while active and turns white once it is set. Once all desired images have been acquired, tap or swipe over to the main menu screen on the touch panel to review. Swipe a finger from right to left across the touch panel to scroll through images and clips taken. Images may be selected individually for full screen review by double tapping the desired image. To change the number of images viewed from the main screen, select the Grid View button. Images may also be deleted from this location by selecting the image and choosing Delete at the bottom of the screen. Post-processing may be performed on prior exams, such as adding annotations or measurements. Once all necessary changes have been applied, select Exit to return to the main imaging screen and select End Exam. If the system has been set up to transmit images to a PACS, images will automatically send when selecting End Exam. Select iStation from the menu screen to access a list with all prior exams. Review, delete, or send past exams from this page. The ME8 has the ability to reactivate an ended exam, add images, or update patient demographics. To change patient demographics, tap once to highlight the desired patient and choose Activate from the drop-down menu. Navigate to the Info tab on the touch panel to change demographic information. To update, use the cursor to select a field and make necessary changes. Select OK when finished, then End Exam. To delete studies from the iStation archive, highlight desired exams, leaving the most recent exam unselected, then select Delete from the drop-down menu. An application specialist may set up the auto-delete feature, if desired, to ensure the hard drive will never get too full. Auto-delete allows for a set number of exams to remain within iStation. Once iStation reaches the selected number, oldest exams will start to automatically delete from the archive. Please note that once an exam is deleted through the auto-delete feature, there is no way to retrieve it. The Recycle Bin is a tool that will allow retrieval of accidentally deleted studies. Select the Recycle Bin icon in the bottom right toolbar using the cursor to view deleted studies. To retrieve a specific study, highlight that study and then click Restore. This will send the exam back to the iStation archive. It is recommended that the Recycle Bin is emptied after deleting studies to keep the hard drive from getting too full. Programming the button transducer. The L12-3 RCS and L12-3 VNS linear ultrasound transducers allow for operational functions to be programmed to the buttons. There are 3 button controls, 2 on the face and 1 on the side of the transducer, that can be programmed for multiple functions if desired. To program the L12 transducers, access the main menu, tap Setup, and select Key Probe. This displays an illustration of the transducer and applicable button keys. Use the drop-down arrow next to each button to select the desired function or functions. There is the ability to program a short press, a long press, and on K3 a double click as well. Make desired selections and tap OK at the bottom of the screen. Buttons may also be disabled by simply unchecking the box labeled Enable Probe Key Functions along the bottom of the page. Also, as noted on the screen, simultaneously pressing K1 and K2 will disable or enable the buttons during use so that there is no need to return to the setup page while scanning. iScan Helper is an educational reference tool built into the system, which provides tutorials and is exam mode specific. To initiate iScan Helper, select the desired transducer and exam mode, Then tap the iScan helper icon on the touch panel. Select the target view and the system will display 4 different informational screens. The system will display an image which portrays proper transducer placement, desired ultrasound image, a graphic pictorial, and additional scanning tips. Tap the iScan helper icon to exit. Please note, images cannot be saved while iScan helper is active. The iWorks option is Mindray's protocol feature which allows for guided pre-labeled exams. iWorks is exam mode specific, so first choose the transducer and exam mode. To activate, tap the iWorks tab on the touch panel. A list of iWorks protocols will display to choose from. Tap the applicable protocol from the list. iWorks comes equipped with a large library of factory protocols, but custom iWorks can also be created. An application specialist can help build custom protocols to desired specifications. Once a protocol has begun, the views will be displayed as thumbnails on the right side of the monitor and on the touch panel, as well as any associated annotations. Obtain the view and tap Save or Save Clip to store. For views that activate different modes, require measurements, or activate dual, follow the prompts along the bottom of the imaging screen. The system will automatically advance to the next view, or tap on other views using the touch panel to advance to different areas in the protocol. Proceed in this manner until the iWorks protocol is completed. iWorks is designed to offer flexibility while scanning. To the right of the views on the touch panel, there are tabs available to repeat, replace, insert, and delete a view. There is also the option to pause the iWorks protocol if needed and resume later. To pause, tap the Suspend tab. To resume, tap the iWorks tab again and the protocol will pick up where suspended. Continue until complete. The Stop tab ends the protocol but does not end the exam. Continue to scan the patient outside of the protocol if necessary. When ready, tap End to close the study. The iNeedle function can be assigned to a control panel key or touch panel tab. Choose iNeedle from the assigned location. iNeedle is compatible with all linear and curved transducers. This needle visualization software is based on beam steering and only functions for in-plane procedures. The system electronically steers the ultrasound beam towards the perpendicular interface of the needle, thus enhancing the needle appearance. Notice the degree of inclination automatically adjusts to the degree of the needle trajectory. iNeedle controls can be adjusted on the touch panel under the iNeedle tab. Initiate the L11-3 VNS transducer in preferred exam mode. Press the eSpatial Navi tab on the touch panel. Verify the needle being used is approved by selecting it from the list in the eSpatial Navi Needle tab. Press the calibration button with the transducer approximately 12 inches from the system and at the same level as the top of the ME8 monitor. Make sure the transducer indicator notch is toward the left of the screen during calibration. The notch correlates to the M on the imaging screen. A message will appear when complete. Recalibration should only need to be performed once each day, or if a different needle is chosen from the list. Magnetize the needle by placing it in the magnetizer with the cap on, all the way to the bottom for a second, and pull back out. Notice the trajectory or dotted line on the screen before touching the patient with the needle. For out-of-plane procedures, change the angle and degree of the needle to change the target box location. Advance the needle towards the target. The top yellow dot is the needle tip. Blue indicates the needle is crossing the ultrasound beam, light blue is close to the beam, and orange means the needle has fallen out of the ultrasound beam. For in-plane procedures, the colors mean the same. Once the box is blue, the needle is in plane with the ultrasound beam. Light blue means the needle is close to the beam, and orange has fallen out of the beam. Notice the graphic at the upper left of the image, which shows the needle orientation in relation to the ultrasound beam. AutoEF is a quick tool that provides left ventricular ejection fraction based on the Simpson's method. AutoEF can be used either on a saved clip or while live scanning. Using the phased array transducer in a cardiac exam mode, obtain an apical 4 or apical 2 chamber view of the heart, and hold the view or have a previously saved clip playing on screen. Press Measure, then choose AutoEF. The system will automatically analyze and trace the left ventricular chamber in both diastole and systole, providing ejection fraction and volume data. The placement of the tracing points can be adjusted manually if needed. The system automatically identifies these two views. However, click on the view label in the upper left if it is misidentified, and the system will reanalyze the clip. A progress bar will be displayed along the bottom with results. To adjust the placement of the tracing point, use the cursor and trackpad. Place the cursor near the image and a section of the points will turn yellow. Touch the trackpad or use the set keys to grab the points and drag them to the desired position, then tap to release. On the touch panel, there are additional control options. Accept results will place data into the report. Finally, there is an Exit tab when finished. Additionally, pressing the Save key will both save an image of the screen and put the data into the report. If desired, repeat the process with the other view. Analysis of both an apical 4 chamber and an apical 2 chamber will yield biplane results. The Smart VTI tool provides quick analysis of a patient's stroke volume and cardiac output. Smart VTI is done while live scanning and cannot be applied to a previously saved clip. Begin with your phased array transducer in a cardiac or fast exam mode, then measure the LVOT diameter. The LVOT value may be entered later if desired. To measure, obtain a parasternal long axis view and press Freeze. Scroll to End Systole, tap Measure, then choose LVOT diameter, and place the calipers to measure the outflow tract. Take care to tap the last caliper so that the measurement turns white. This assures the value is saved for the upcoming calculation. Next, obtain an apical 5 chamber view of the heart and activate Smart VTI with the tab on the touch panel. The system will enter pulse wave Doppler, automatically placing the sample gate in the LVOT. Adjust the position of the gate in the reference image with the trackpad if needed. The system will begin auto-tracing the Doppler envelopes and calculating VTI, SV, and CO data. Press Freeze to stop the Doppler acquisition and analyze the data. An LVOT diameter is necessary to calculate a stroke volume and cardiac output, so if it was not manually measured earlier, use the LVOT diameter tab on the touch panel to enter a numeric value. The Doppler envelope being used for the displayed data is the last one to the right. It is indicated with dotted lines. Scroll to a different complex if this one is suboptimal, or manually adjust the trace with the Edit VTI tab using the caliper and touchpad. Data will change as soon as a different complex is chosen or there is a change to the tracing contour. By turning on the graph and tapping Save VTI, the system can plot multiple data points for the patient. The data from Smart VTI can be found in the Fluid Management report type. Smart IVC is a software option that is used to automatically trace the IVC diameter changes and calculates the collapsibility index for spontaneous breathing and distensibility index for mechanical ventilation. Smart IVC can be performed on real-time images or stored clips. To calculate during real-time imaging, scan the IVC in long axis and press the Smart IVC tab on the touch panel. The system will automatically locate the IVC target area, track, and measure the change in IVC diameter. Select Spontaneous Breath or Mechanical Ventilation, which is located on the touch panel under the Smart IVC tab. If sampling position is suboptimal, tap the Edit Line tab. This will allow for modification of the position and angle of the sampling line. To initiate a graph displaying the results over time, which will appear in the upper left corner of the imaging screen, press the Save Data tab in the lower right corner of the touch panel. Smart IVC will automatically calculate the respiratory cycle, but it can be edited by selecting the Change Respiratory Time tab, which is located on the bottom of the touch panel. Smart B-Line is an AI tool which will identify the pleural line and provide quantitative analysis of B-lines, as well as provide lung scores. Select the desired transducer and lung exam mode. The Smart B-Line function may be performed during live scanning or from a stored clip. Tap Smart B-Line to activate the Smart B-Line feature and select the desired lung map and zone. Obtain an image and select AutoCalc to start analysis. Press Freeze to display results, press Save to archive, and unfreeze to proceed to the next lung field. The system automatically detects the rib acoustic shadow, analyzes and calculates the B-line number, distance, percentage, score, and also automatically displays the image with the largest percentage. Repeat for all lung zones. Quantitative indicators, including B-line count, distance, and B-line percentage, will be displayed in the top right corner of the image. When all lung zone images are completed, select Overview to review the results for each lung zone. The ME8 is easily cleaned and disinfected using an approved product. To clean the touch panel without changing any imaging parameters, select Screen Lock from the menu screen. This will lock the touch panel for 10 seconds in order to disinfect without accidentally changing any settings on the system. Use approved disinfectants only on the user interface. Please reference the provided disinfection and sterilization guide or contact an application specialist with any questions concerning system disinfection.